Hello, everyone, and welcome to another Female FriYay where you can't be what you can't see. Today, we've got the pleasure of interviewing one of my RA heroines, Dr. Athmaja Thottungal. How are you doing, Athma, this morning?
Hi, namaskaram, Becky. Thank you for having me today. It's so
Yeah,
lovely.
you were on my hit list. I could not do Female FriYay without my RA heroine in it.
Thank
So,
you so much.
we're going to start with a relatively easy question. What's your name? Where are you originally from? And where do you currently work?
Okay, so I'm Athmaja Thottungal. I'm originally from Kerala in India. Kerala is known as God's own country. So, yeah, I'm really proud of that roots. Currently, I'm working at Kenton Canterbury Hospital as an anesthetic consultant and also pain management consultant there.
So, what attracted you to pain medicine and regional anaesthesia as a career?
Um, It is both a personal and professional experience. And as you know, as a doctor, I would say almost a 90% of the patients that we see in our practice come to the hospital because of the pain. And in a training period, you know that in a 6-year period that you spend in a medical school, probably we get training to manage pain, probably if you're lucky, for 9 to 10 hours in that 6 years. But you're day in, day out as a doctor, you are managing pain. And you can see why the pain is poorly managed. So, as a patient myself, my pain was managed pretty badly at that time. It's not because the doctors were not good, we didn't have the training. And the personal experience led to the professional experience because, I told you I had a portfolio career. So after my house job, I started as a pediatric surgeon. Very early on, I realized probably this is not my choice or the right choice for me at that time. So I moved to the happier side of pediatrics, which was obstetrics and gynecology. That is where I got exposure to pelvic pain, how young women suffer from pelvic pain and how poorly the pelvic pain was managed. And this was a wake up call because they are in their prime time of their life and people don't believe in their pain. And women suffer in silence, especially the pelvic pain patients. It's a social bias. It is like they are ashamed of that to come up and to talk to a professional. Even the professionals were kind of trying to keep it under the carpet because they don't know how to manage it. And
Yeah.
it is very complex as well. So this was the thing which made me realize I want to get training in pain management, especially in pelvic pain management, because as a woman, as the background of having the obs and gynae, I thought I could do a good job. So the only way I could do pelvic pain was to change into anesthesia. And of course, the regional anesthesia is a big part of it, and to do pain management. So that is how I came to UK, and then rest is history.
Well, it certainly explains all the surgery why your anatomy is so amazing. I thought it was like you were in their textbooks. It's because you've been on the other side of the drapes. That's why.
Yes,
And what do
absolutely.
you think at the moment is the best part of your job? What do you enjoy the most?
I enjoy every part of it. I wouldn't be doing this job if I don't enjoy what I do. I mean, this is something that I learned from my mother. She was a teacher, and she always used to do whatever you do it with your heart and soul. Give your 101 percentage. If there is a day where you think it is not for you, leave it, move on. And that courage that I had to change my career or choose various options in my life, which I'm still doing, that came from there. So it is very important to have that realization. If you do not enjoy something, don't continue there. Don't become a pain for others. Move
That's
on.
true.
Life
Uh,
is very short.
and what do you think you might be doing if you weren't an anaesthetist or a pain doctor or a surgeon or an obs and gynae person? Of all the things that you've done in your career, do you think you do something outside of medicine?
I still have it is not a career. I still enjoy and do a lot of things outside medicine. As I told you, for me, life is a gift. It's beautiful. So I grab every opportunity that I get in my life, whether it is in a career or it is personal or professional. I give my best. I try to enjoy every moment of it. I mean, as a relaxation or a something that I potentially could have become my career is like being a dancer. I used to run a dance school. I still enjoy it. I still do
Wow.
musical arts and things like that. I do a lot of charity work. So, anything that I do, I find happiness in it, so I enjoy, and I can convey that to others as well. So I mean, it's a very difficult question to answer, that this is one thing that will make me happy. I find happiness in everything that I
You
do.
sound really busy. I want to know how you juggle, like being a top block babe and being a mummy and getting all of these things in. You must just be hyper organized.
Mm, uh, you know, it is like having the priority. I live in the very present moment.
Yeah.
I cannot sit and crib about, oh, I should have done this, I should have done that, oh, this is what I'm going to do. Of course, I am a dreamer. I dream a lot. And probably the driving force is those dreams. But it does not hold me back from being present here. So I enjoy every moment where I am alive at this very moment and give my 100 percentage, which is
So, Asma, what is your favourite block? And if you don't have a favourite block, you can tell us your favourite dinosaur, as Ed Mariano did. He went for a dinosaur.
block. Favorite block? It's very difficult to answer that, Becky, because I love every block. I love every
Okay.
block. As a pain clinician, as you can imagine, we block head to toe.
Yeah,
Literally every
absolutely.
nerve possible, not as any regional anesthetist, because in regional anesthesia, we are going for the chunky ones, the big plexus block. But in regional anesthesia, you cover the tiniest nerves in all sorts of places, which is really challenging. That is why your anatomy knowledge is so important for you as a pain physician, because all these entrapments can happen in every kind of corner of your body. But if I have to choose, like, probably I would say region wise, rather than a very specific block. So in my dictionary, whatever gives the patient the best pain relief is my favorite
Good
block.
answer. Good answer.
And the head and neck region, I would say superior trunk.
Okay.
Uh, and still, I use like a half a mil to 1 ml for my chronic pain superior trunk, and maybe 4 ml for acute pain for reverse shoulder. So it is absolute magic. Imagine having a reverse shoulder surgery just under
Yeah.
4 ml of local anesthetic. It is pure magic. And also, I combine the neuromodulation technique with that as well. In the thorax abdomen, I would say genitofemoral nerve,
Okay.
because genitofemoral nerve, all the descriptions that is in the textbook is all about men. Because we say, scan the spermatic cord. Hello, we are women, and most of my patients are women. We
Yeah,
don't
that's
have
true.
spermatic cord. We won't have spermatic cord. So using the spermatic cord as a surrogate marker doesn't work. So in many textbook, I wrote chapters with Professor Peng as well, a different technique how to scan the genitofemoral nerve. And that is my favorite in the abdopelvic region.
Right, Athmaja, we're going to move on to our block break, if that's all right. And I'm
Absolutely.
going to ask you 1 minute of questions completely unrelated to regional all pain. So if you're ready, I'm going to start my timer.
Yeah, fire away.
What's your favourite pizza?
Vegetarian, veggie.
Okay, and what's the first thing you do in the morning?
I wake up being grateful, thankful. I give a big grin. I'm alive still.
And
Yeah.
if you could travel anywhere in the world, cost and time aside, where might you go?
I will go back to my mom's womb.
Okay. And are you a spring, summer, autumn, or winter person?
I love all seasons, but the most romantic one is probably autumn. I love autumn.
Okay. Are you an early bird or a night owl?
Both.
Oh my word.
Depends upon what I want to do. So if I am working on something, I may go for like a late night, but I wake up early morning because I do regular yoga, so I wake up in the morning. So
Okay. Are you a cats or a dogs lady?
uh, both. But I do have a cat now. I mean, we have two cats at home, but
Yep.
I love all animals, all creatures.
And finally, if you could click your fingers and be an expert at anything in the world, what might it be?
Um, Probably I would be a better person in writing articles because I'm rubbish. So people ask,
I hear
"Oh, where
you.
is the technique? Where have you described this?" And I say, yeah, I'm rubbish at writing things up. I'm good at doing things, but I'm rubbish at writing things. So I
I
would
hear
like.
you on that one. I'd like to know how people do it much more efficiently than me. It takes me like weeks and weeks, and I just turn into like Gollum and like at my computer hunched over. Okay, so you talked a little bit about your career path, and more recently, you've been incorporating lifestyle medicine into your pain. How did you kind of get into that?
Oh my God, this is a life-changing event for me, actually, Becky. As you know, 2020 changed everyone's life. Yeah, COVID came, everything changed. I mean, even as a pain physician, I always felt there was something missing. I was good at doing procedures. I was good at managing my patients with medication. I was good at giving advices, but it was not a concrete advice, or I always felt probably that is not the right form of advice that I'm giving. That clarity was not there. I had COVID 3 times. Okay.
Wow.
And the first one was pretty bad in 2020, February, March. I recovered from that reasonably okayish, but not very well. But 2020 December was my life-changing time. I had my second COVID and I was hit really badly. I was on the verge of getting intubated, ventilated.
Wow.
And December 24th, 2020, I know I was talking about that to my friends and family during this Christmas time, how grateful I feel for this wonderful opportunity again to live my life again. Because that day I was mentally getting ready to say goodbye to my family. I was desaturating. I was hallucinating. I could not even remember where I was. I was pretty bad shape at that point. I kind of got better from there because they came in, the hospital at home came in because the hospitals were fully, completely packed with the COVID patients. There was no ITU beds or anything. So hospital at home team were doing good job. They came in, they gave, oxygen and steroids and everything. I turned the corner around, but that was just the beginning. The person, you can imagine, you ask me, you are a busy person, what do you do, how do you manage time? So from that kind of level of activity to a person who is absolutely horizontal on the bed or the sofa for almost 24 hours a day was real life changing. I had a lot of complications from COVID, developed long COVID, all sorts of things. And I realized from a modern medicine point of view, there were very little that people could do for me. I had autoimmune dysfunction, autonomic dysfunction, and the other long COVID symptoms like a brain fog. The brain fog was just crippling. This is where my journey started. How can I get better within myself? Because your body is amazing. The healing capacity your own body has got. We never tap into that. This is where my journey with the lifestyle medicine started and the interest in the gut microbiome started. How, I mean, our moms used to say, you are what you eat.
It's
And
true.
even Hippocrates said, the food should be your medicine. If not, you will eat medicine as your food, which is what is happening at the moment. Most of the people are eating the number of medications they are eating. It is pretty much the same size as your food. So this was a completely different perspective to my medical career altogether. Now I feel I'm more sort of a more complete physician, where I truly look at you as an individual and I can approach you as a in a holistic manner, which I am transferring those skill into regional anesthesia, into pain medicine, into anything and everything that I'm doing as a doctor. So I feel when I became a patient and I realized when you are on the receiving end, what matters to you most, that it definitely has made me a better doctor, better human being, and also to widen my, perspective about what good healthcare is.
Yeah.
So that's why I'm doing, lifestyle medicine as a part of it as well.
I love it. And what do you think has been your biggest career achievement so far? Because you've achieved quite a lot of things. Hate to say
Um,
it.
this people say that career achievement. I mean, everything that I have or where I am today is an achievement. Being alive is the biggest achievement. I
Sounds
would.
like it. It sounds like it was a very scary experience.
Absolutely. So I'm grateful for all those, grateful for everything that has happened in my life and to all the lovely people around me. But if I have to choose one thing, combining personal with the professional, I would say, my kids are my biggest fans, I would say, and my of course my husband. Without my family support, I wouldn't be here where I am. So I remember going to one of the extra meetings with my daughter, and she was just entering into the medical career at that point. And a lot of our regional anesthesia colleagues and pain colleagues there in the extra, when I was introducing her to my daughter, and they all said, "Oh, your mom is so lovely, and your mom is great." And then I could see that proudness and proud sparkle in her eyes. And again, that was one of the best moments for me because, me and my daughter, we are best buddies. So for me, it was something where I felt, yeah, not only as a doctor, but as a mother as well, I did my best. And my son, again, he's so proud of his mom. He always say, my mommy, my mom. And of course, my husband, I can't say anything without being thankful to him, being so supportive. And, of course, my family and friends who's been great support for me. So everything that I have achieved. And also, I always remind myself and my kids as well, nothing came without having failure. So I do not
That
take
was
it.
going to be my next question.
Oh, I see. Okay.
What do you think your biggest failure's been? Or do you have any standout failures?
No, I do not take anything as a failure. I take everything as an opportunity. So if you think your career is or the graph is only upwards, then the next thing is coming down. Yeah. But if you are on the floor, the only way is you can rise up and go. So I do not take them as a personal failure or anything like that. I have had, yes, I had failure in my exams. I had failure in applying for positions. I had failure in blogs. It didn't work the way I envisaged or I saw it will happen. But it's not a failure. I take it as a great opportunity to reflect, learn from it, and move on. So I wouldn't say that was any greatest failure as such in my life. Everything was a great opportunity for me. Yeah,
Building blocks.
absolutely.
And because you're such a block superstar, what advice might you give women coming up behind you in the field of regional anesthesia and pain medicine?
I remember one of the sayings that influenced me a lot as an individual, even from my school age, is one of Swami Vivekananda's saying. It goes as it is. Okay, so it's like saying, "Stand up, be bold, be strong. Take the whole responsibility on your own shoulders and know that you are the creator of your own destiny. All the strength and success you want is within yourself. So make your own future." I had it.
Perfect.
I had it on my table. I had it on the workplace.
It sounds like it needs to be one of those posters, you know, with the cats that do
Yeah,
the.
absolutely. I mean, he influenced me a lot, Swami Vivekananda. And even my mother, she always said that, do it with all your heart and soul into it. So, it doesn't matter. Don't try to please others. Do it for yourself. Believe in yourself. Don't take anything as a yes or a no for yourself because someone else told you. Convince yourself, do your best. And if you feel you are doing the right thing, go for it. And dream a lot.
I love
Never.
it. Absolutely inspirational. Athma, thank you very much for joining us today on Female Friday. It's been a pleasure talking to you, and I feel slightly inspired now.
Oh, thank you so much, Becky, for having me. And it is great to see, you are taking so much time and effort to spread the word of this girl blogs. And I always say, this girl not only blogs, we do a lot of
We
things.
do, we do. We're multifunctional. Thank
Absolutely.
you very much for joining us and enjoy the rest of your day.
Thank you, Becky. Namaskaram.